the numbers appear to be alarming. Kita nyo nga, bigla kaming napa-face shield ulit dito sa studio. But tell us what really is the picture that's emerging. Kasi we understand from the DOH na mukhang hindi raw variant-driven itong numbers. It's more daw of carelessness-driven or, being so complacent by the population. Does that really make sense? Does that make sense? Is that really the reason for this significant increase in the numbers?
I think we need to review the statement that was given by Yusek Perhere. I don't think she said naman na it's not variant-driven. From what I understand, she was being very careful to attribute it entirely to the variant. Kasi kung titignan natin yung numbers, and we're looking at the same numbers, diba? Their team is the one sharing it to us. Yung numbers of the numbers of positive cases attributed to the variants are actually less than 5% total. So paano naman natin sasabihin na yun lang ang pinaka-problema? Pero I think what we need to consider is that the fact that you pick it up means it's there. You may need to be able to prove that it's really the thing that's driving it. Pero regardless whether it is the driver or not the driver, you end up with the same intervention that needs to be done. So parang moot actually yung point, di ba?
Yeah. Doctor, I think kasi kanina tinanong ko rin to kay Secretary Vince Dizon And you're absolutely right. When it comes to the individuals, wala namang magbabago di ba? Parang doesn't really matter kung ano yung source, kung ano yung variant, it's the same practice. But I think people are asking what's really driving this because it's on the level of government response, particularly on the level of restrictions, on GCQ ba tayo? Do we go back to a harder lockdown? That's where people want to see some adjustment because while we keep reminding people, best practice, best practice, best practice, government keeps saying, let's open up, let's open up, let's open up. And so there lies the dissonance that I think people are trying to understand. And so that's why they want to see how legitimate is it that it is the variance that is driving this, because our best practices brought down the numbers in December. Diba? If you ask the people, it looks like people have been complying.
So those are really good points, no? And siguro because I am external to the Department of Health and taking this all from the health lens as a clinician and a pediatric infectious disease specialist, syempre ang perspective ko is always kung pwedeng maging mas strict in terms of movement, bakit naman ako hihindi? Bakit ako aayaw? Kasi gano'n naman ng aming perspective pagka nakakakita kami ng any other outbreak in any other setting. Gusto namin i-contain bilang healthcare professional. The thing is, the decision is really in the hands of the IATF. We can only make recommendations. And I think yung pinag-iingatan lang naman talaga siguro from the group, the variance group, is to make sure that when we make a recommendation, there has to be, or rather when we make that report, there has to be a really good basis to say, talagang sigurado kami na itong pagdami ng kaso is can be attributed primarily to the variants. We just don't have that kind of information yet. Now, having said that, there's nothing stopping us from acting in our individual capacities as if the variants are the ones driving this, and to be extra careful about making sure that we protect ourselves and our families.
While waiting for the results to find out kung this is variant-driven nga, is there any particular activity that you would like restricted kahit konti lang? Para lang makapag-ingat-ingat tayo.
Well, siguro from the HPAC lens, the things that we pointed out at the start were what we would call enablers, parang things that would allow people to be able to implement the apat-dapat. So sinabi natin, kailangan may magandang ventilation, kailangan may physical distancing. Yung kaya lang talaga natin gawin on our own, I think, is always wearing the mask and shield and controlling our time of exposure, no? Pero yung physical distancing, kung nagko-commute ka tapos siksikan dun sa sinasakyan mo, parang mahirap yata yun, di ba? Tapos yung ventilation, siguro kung meron na tayong public standards that establishments can comply with, maganda rin, makakatulong din yan. So, yung mga factors na yun, pwede pa yung pag-igihan, no? Pwede pa sigurong tutukan ng mga local government units or ng national agencies para whether or not meron tayong increase in cases, na bibigyan natin ng pagkakataon yung mga tao to comply to the best of their ability because the environment allows them to do so.